Hello, everyone, and welcome to this recording, Navigating Homozygous FH, the insights from a clinician and patient perspective on today's journey. This webinar is an extension of the impactful work that FH Europe Foundation have been doing in the space of this more severe form of inherited genetic lipid conditions, homozygous FH. We will explore the efforts in addressing the everyday life of those living with homozygous FH and some of the advancements in the new innovative treatments and the future of precision medicine in this arena. HoFH Europe Foundation is leading the way in improving awareness and the amazing campaign that was run by our patient ambassador from Lebanon, Lecha, who joins us today on the call. During this time, there was an incredible trilogy of webinars where we had expert panels that comprised of not only clinicians and researchers, but patient experts who was the sparring partners, asking questions, clarifying specific areas and the impact of living with HoFH. Some of the key points that we covered during this time was raising awareness, early detection through the work done with the Prague Declaration and development since then, genetics, the impact of precision medicine, and current treatments and managing the condition. There is so much more going on, but we will continue to share all of this with you. This includes recordings and findings from the heterozygous FH, because as we know and we've seen that there is no HoFH without HeFH. We have a strong belief in education and the impact of empowering our community through knowledge. Links to the recordings and information will be shared at the end of the discussion today, but do go and have a look on the YouTube site as well for a lot more information. We will also share the links and information about projects regarding research and innovation through PermedFH and Perfecto, and these will be covered in more depth at the annual meeting as well and later educational recordings. As a community, our ambassadors actively engage in ad boards, in projects to ensure that our voices are heard. And this recording will offer the opportunity for two of our patient ambassadors to share their experiences of living with and supporting those living with HoFH. So thank you for joining us today, and let's delve deeper into how we can continue to transform the lives and pave the way for a healthier future. With this in mind, I would like to introduce you to Lecha. So some of you might already know her from the incredible campaign that was run for the HoFH Awareness Day. She's an incredible young woman who advocates not just for herself, but also those living with HoFH globally. She has been part of talks at the Global Heart Hub, at World Heart Federation, and recently setting up a patient organization in Lebanon, and so much more. Another amazing ambassador that we have is a young person who has overcome many barriers and still stands strong. She is a dancer, a student, a daughter, and a voice for our community, Avery Watts. We will also include the link to Avery's fight, where you can learn more about the incredible work that Avery and her mum Michelle has done over the years. Last but not least, Professor Fotios Barkas, Assistant Professor of Internal Medicine at the University of Ioannina, Greece, specialized in focus on cardiovascular disease prevention, particularly in the areas of lipids, obesity, and diabetes, a PhD on cardiovascular disease risk factors in dyslipidemia patients, accomplished researcher, presented at international conferences, but more importantly, also part of our Ambassador Education Program advisory and a faculty member. Now I will hand over and they can share their journeys, ask and answer some of the questions that they have that they've come across navigating living with homozygous FH. So I'll hand over to Sherelle, who will share her journey with HoFH, diagnosis, trials and treatments that she's gone through, and some information that she can share. Thank you, Sherelle.
Thank you, Asi. So my story began early, luckily. When I was very young, less than 1 year old, my mother noticed small yellowish spots on my skin. Those signs that led to countless visits to doctors, each trying to piece together what it meant. So eventually, after several referrals, my family and I received the life-changing diagnosis of HoFH with a simple blood test, but then my genetic diagnosis came a decade later. So I was put on a strict plan, starting with medications and then eventually led to LDL apheresis. My first experience with apheresis was at age 8, and to say the least, it was overwhelming, and I didn't fully understand it, and I felt like I was scared and isolated, and I actually refused to go back to apheresis the first year. But then with my family's support, I persevered, and over time it became a routine part of my life. But now, as an adult living in Lebanon and facing the country that is facing an economic and a political crisis, I'm navigating new challenges. So treatments are often unavailable, leaving my brother, who also lives with HoFH, and myself and others like us with the difficult task of looking for alternative options like treatments abroad. We've had to research everything from finding which country have apheresis to finding doctors and clinics to covering treatment costs. And that is even before thinking of the logistics behind moving to another country. So it's a lot to carry, but it also sparked a deeper commitment to advocating for myself and others like me. And this treatment journey has taught me so much about resilience. Even though it wasn't easy, I grew to understand and accept that managing HoFH would be a lifelong commitment. And it's not just about enduring the physical challenges. With HoFH, I've realized that the emotional aspect is just as critical. Finding strength to continue this journey, staying hopeful, and knowing that there's a community actually to lean on. So I've come to see the power of sharing our stories, and not just for awareness, but also to drive real change. So advocacy now has become a vital part of my life, and I'm grateful for the chance to support and the community and push for a future where no one faces these battles alone.
It's an amazing story. Thank you, Sherelle, and thank you for being brave enough to kind of share it with us as well. So next, I would like to ask Avery, maybe you can share about your diagnosis, your journey, and some of the trials that you've gone through.
Hi, my name is Michelle Watts. My daughter Avery was diagnosed with HoFH when she was 6 years old. I have 3 children. I had taken them to their pediatrician for years and had told the doctor that we have high cholesterol in our family and we have early cardiac events in our family, yet no one had ever suggested that we get a that we scan, do a test to test their blood levels, their lipid levels. So I requested this test, and Avery's total cholesterol came back over 800. My oldest son's cholesterol came back at over 300. So he has heterozygous FH. And then our youngest son does not have FH at all. It's been a long, very frustrating and scary experience. When Avery was just before her 7th birthday, we had a permanent port put in her chest so that she could start LDL apheresis treatments, which we did every week for many years. The hospital that this is done at is approximately 3 hours from our house. So those were like 12-hour days between travel and apheresis and just everything that went into it. So that was a very difficult period. In 2020, in January of 2020, Avery had her first open heart surgery, followed by an emergency second open heart surgery less than 24 hours later. She also suffered a heart attack at some point during that 24-hour period as well. 2 years ago, she had her third open heart surgery. We're hoping things will calm down and we won't have any more surgeries for a while. However, we do know that there's a great possibility in the future that she'll need to have more surgeries. We started an online presence called Avery's Fight right soon after she was diagnosed. age 6, and we invite you to follow us on Instagram and Facebook, and kind of follow along Avery's story and her experience, and our whole family for that matter. Because when you have somebody who has HoFH, the whole family is really affected. Thank you.
Thank you for sharing that. So I have a question, because both of you have been advocating at different times, and Sherelle, you are kind of advocating for yourself, but also for your brother and your community. And Michelle, I'm sure this was probably not something you originally thought that you would be advocating for, but you've been in the environment for a while. How has your views changed about advocating for yourself, but also for the larger community?
When I first reached out to HoFH Europe was because I wanted to leave the country. But then when I experienced firsthand what this organization did to us, like the patients, I feel like I was given this privilege, and I want, to continue with the mission that HoFH Europe Foundation represents. And I feel like it's a responsibility, actually, because I've been given this platform, and I've been given a place where I can amplify the voices of others as well, especially in my region, since it is a bit of a cultural thing here to, be afraid of talking or raising the voices of the people affected by rare conditions. So for me, this is a responsibility and a privilege, and something that I now don't see myself doing anything rather than this.
How has it changed? My husband and I actually were very quick to jump into the patient advocacy arena quickly after Avery was diagnosed. And I've always said that maybe this happened to our family because I have that voice in me, and I can be outspoken, and I just want to be involved in furthering the advocacy. HoFH Europe Foundation has greatly helped us amplify, like Sherelle said, amplify our voices, and we certainly hope that by doing so, things will get better here someday. It's all we can hope for.
It is an incredible job to do, to speak up about something that is very personal. So it is, yes, as an organization, that they can all stand behind you, but for you to stand up and actually tell your story is amazing. So thank you. So we talk a bit about kind of treatments and management of treatment. What have you found over your journey that has been the most effective?
So physically, I've only had 2 options as treatments here, and I find that never skipping apheresis and always taking my medication is something, and also as long as I can follow a healthy, strict diet, but temptations happens. But I've always been, on the healthier spectrum because I work out and I want to look good, but. Yeah, so apheresis, medication, and overall being on a positive, because emotions do affect us physically as well. As you know, this condition is a silent disease. There's no physical symptoms to it, but knowing that I'm doing everything I can and keeping my levels under control also gives me this, healthier. How do you say it? Healthier, lifestyle.
Yeah, Michelle.
Avery is, I'll start by saying, lifestyle wise, Avery has been a dancer since she was 5 years old. I'm sorry, since she was 3 years old, actually. She is now 16 and dances pretty much 7 days a week for hours at a time. So she is very, very active. As far as treatments go, LDL apheresis has been a real lifesaver. Avery is receptor null, meaning she doesn't have any receptors for medications like PCSK9 inhibitors. So she can't take those. They won't do anything for her. So apheresis, taking a statin, using other medications, and she's now on a medication we have in the U.S. that is given by transfusion, which she receives once a month, and that has also greatly helped.
Fantastic. So we know that this can be quite an emotional and challenging time while being, that keeping positive, and especially when you have to go for treatments on a regular basis, and, it's, or you don't have access, or you have access today and tomorrow you don't. All of these things play a part. But if you could give any advice to your younger self, I was going to ask Avery if she has any advice about how she manages it. So she might have to kind of whisper to you some of those. But Sherelle, while they kind of thinking about it, what would be the message you would give your younger self, or somebody living with HoFH?
Honestly, remain hopeful, stay positive, and surround yourself with a good support system, because this is what really kept me going. Whether my family, my friends, but having the positive outlook on things. I know it's very daunting, and I personally didn't go through the very severe physical challenges, but my brother did, and I've watched him go through the open heart surgery he was 25, and because I know that we have the same condition and we've been through the same treatment journey, so that somehow affected all of us emotionally, and I was afraid that something's going to happen to me the same way that it was happening to him. But, not everyone is like the others. Every case is different than the others. And just remain hopeful and look up.
Michelle?
I'm not exactly sure. So Avery has had a very, very positive attitude from the time she was diagnosed. I don't think, I guess I can count on one hand the number of times she has ever raised her voice to say that she was upset that, that she had this condition. She's just kind of, it is what it is, and I'm going to make the best of it, and it's always just kind of been very matter of fact like that.
Excellent. So in a minute, I'm going to ask, Sherelle's got some questions that she'll ask Fortis. But before we get there, if there was one message that you could give researchers and clinicians to understand, because the majority of us are very positive, because we have to be, you can't just say it. But sometimes that can come across as distant or not really that engaged. So if there's a message you could give to one of the researchers or clinicians or people that help us, what would that be?
My only the thought that came up to my mind is think about the humans behind your numbers. I know that sometimes studies exhibit case 1, case 2, but we're humans, we're living with this condition. So, keeping in mind that there are people, families affected by this would be good. And, for practitioners or healthcare providers to really listen to their patients and to, give them the attention and the time to speak and to deliver their words and concerns. That would be my message, I think.
Michelle?
I agree with everything Sherelle said. I think it's very important to remember that that we're not just a name on a piece of paper or a number. We're real people, and we are the ones who are dealing with this every day. For better, for worse, whatever may come, we're out there in the field actually dealing with it. My biggest hope is that children or people, individuals, would be diagnosed earlier. And to do that, we need universal testing earlier. A lot of physicians still aren't testing children, at least in our part of the world. And if I hadn't asked for my children to be tested, God only knows what would have happened with Avery. So to have that in the back of their mind, and hopefully there will be more testing.
Thank you. I will hand over to Sherelle, who's got some questions for Fortis, yeah?
Yes. So hi again, Dr. Photius. So before we start, could you please give us a quick reminder about the difference between homozygous and heterozygous FH?
Yes, sure. So it's the main thing. It's a common metabolic disorder, which we know that it is associated with increased LDL cholesterol levels at the time that we are having our birth. The main difference is the fact that on the one part, heterozygous FH, which is more common, has only a single mutated gene, which leads to increased LDL cholesterol levels, and we usually take it from one of our parents. But in this condition, LDL cholesterol is elevated, but it's not so much high as we know in the case of homozygous FH. And persons with heterozygous FH typically have fewer cardiovascular events compared with the homozygous FH. So in this case, usually the persons who are diagnosed with homozygous FH have two variants at two different genes or at different chromosomes or at different loci, but we know that these persons have much higher LDL cholesterol levels, meaning over 40 milligram per deciliter, and this leads to very increased cardiovascular risk. That means if these persons are not diagnosed from early in childhood, that means that they may have a cardiovascular event at the age of 20 or 30 years old, unfortunately. And the main difference between them, and this is why we have to perform a genetic testing. Genetic testing is very important for these persons to secure a personalized treatment, because it is very important to know if a person with homozygous FH have a null LDL phenotype or not, because this can allow us to predict the phenotype of this disease. That means that we can predict how this person is going to, what is going to happen to this person in the next years. And of course, which treatment has the higher probability of a higher LDL cholesterol reduction, because, for instance, if someone doesn't have any LDL receptors, that means that he or she is not going to be treated well with PCSK9 inhibitors, for instance. And this is why we need the novel treatments like NGPTL3 inhibitors or lometabide.
Amazing. I was going to ask you about how critical genetic plays in the condition, in defining or diagnosing a condition. One challenge we've seen is the risk of HoFH being misdiagnosed or overlooked. As we know, I personally had physical symptoms, but others might not have the physical symptoms. So why do you think this happens, and what could be done to improve diagnosis?
Yeah, unfortunately, this is a fact, because we know for now that only below 5% of individuals with homozygous FH are diagnosed, and we have to do many things to overcome these barriers. So, of course, we have the inadequate awareness and assessment efforts to diagnose this disease. And on the other hand, we have the lack of connection between clinical diagnosis and genetic testing, or the interpretation of the genetic results by the healthcare providers or the payers. And this is why, unfortunately, that happens. So in order to overcome this barrier and to increase the rates of diagnosis of this, it's a rare form of a metabolic disease, but we should be able to diagnose it. And in order to identify these individuals and treat them as early as we can, we should do more things. And for instance, I would suggest many educational programs in the case of, of course, in a national level. Of course, we should do something about the availability of the genetic testing, which is very important for the diagnosis and the treatment of this condition. And this is why we should do more in a national level, or even more in an international level, to secure better screening methods or availability of the genetic testing in order to increase the rates of diagnosis of this very rare disease.
Thank you. Amazing. So I've mentioned earlier that I've grown to learn that managing HoFH is a lifelong journey. But how critical is regular monitoring and follow-up for HoFH patients, knowing that this would be for life. So how critical it is to always get a checkup.
I think if you ask me, the first thing for this condition is to diagnose these persons. And the second thing that really matters is to secure a very close follow-up for the next years, because in this way we can check the LDL cholesterol levels, the adherence to treatment, because we shouldn't forget it's not very easy for a child to take every day his or her pills, or even worse, to perform a lipoprotein-apheresis. It's very difficult. This is why we need a close follow-up for these persons to check the LDL cholesterol levels, the efficacy of the treatments that we prescribe to these persons. Of course, the safety of these treatments, even the traditional ones, but also the novel ones. And of course, we should not forget the cardiovascular imaging and follow-up of these persons, because we do know if someone has a cardiovascular event, okay, we would know and we have a closer follow-up. But what happens with those that might have subclinical atherosclerosis? That means that you might have atherosclerosis, but we can't predict it, or we can't diagnose these conditions based only on the physical examination. So this is why we need cardiovascular imaging. So for instance, every person who is diagnosed with homozygous FH should at least perform a heart ultrasound at the time of the diagnosis to check, for instance, the aortic valve, to confirm or know the presence of aortic valve stenosis, and then perform the heart ultrasound annually. And of course, you have other non-invasive, let's say, cardiovascular imaging methods, such as CT angiography, which permits us to check whether coronary atherosclerosis is present or no, and then we can decide later if we have to repeat these imaging methods or not. But this is very important for every person who has homozygous FH to have a close follow-up with, of course, LDL cholesterol checking, adherence to treatment, and finally, as I have already told you, the cardiovascular imaging, if this is feasible, of course, and we can decide later how often we can repeat this testing.
We would say that it should be like a yearly routine for all of us to be checked.
Yeah, at least yearly, yeah. And of course, it depends on if someone reports an adverse event or anything else. Yeah, this might happen much more earlier. Yeah.
Yeah. So now, beyond the medical treatments, how can patients effectively manage HoFH through lifestyle changes or other personal strategies?
So of course we do know we need lifestyle changes, of course, in terms of a better cardiovascular health. Yeah, but I should underline from the physician's perspective that any dietary intervention have a modest effect on the LDL cholesterol reduction. But we do need a healthier lifestyle. So when we do have a person with homozygous FH, we should underline that regardless of each treatment that he or she is going to follow in the next years, this person should adhere to a healthy lifestyle and diet. That means that they should follow a diet low in saturated fats or trans fats. And of course, we should incorporate in the diet of other things like fruits and vegetables, which are high in plant sterols and fiber. That all of this together can result in a modest cholesterol reduction, but of course they have a better beneficial cardiovascular effect, of course. And never forget that we need also regular exercise in order to maintain a healthy weight, because we do know also that FH is not protected from other metabolic diseases like overweight, obesity, diabetes. So this is why we should insist on a healthy lifestyle and, of course, diet and exercise. And we should never forget for other factors like smoking. We should avoid smoking, and in this context, we should always insist on an overall cardiovascular risk management, apart from the personalized treatments, which is much more important, of course, but we should also treat these persons in an holistic perspective. Yeah.
Amazing, thank you. So my last question would be, what are some of the latest management options, and looking forward, where do you see the future of HoFH treatments?
So for the moment, we have, of course, we used to have statins, ezetimibe. We had the PCSK9 inhibitors, but all of these drugs depend on the LDL receptors. So this is why we needed much more effective treatments and strategies in order to overcome the barrier, let's say, of the LDL receptors. So we needed LDL receptor independent treatments. And of course, we are very fortunate that now we're having these novel treatments. So I mean that we have lometapide, of course, and the evinacumab, the angiopoietin like 3 inhibitor, which is a monoclonal antibody, and they are very effective treatments. They can reduce LDL cholesterol by 50 to 60%. And of course, we have the choice of the LDL apheresis, which is very effective, of course, and we usually treat patients with the severe forms of homozygous FH, or even in countries when, unfortunately, novel treatments are not available for the moment, I hope. And in the future, of course, we're expecting other treatments. Let's say that this time we are speaking, there are other treatments like small interferon RNAs that target PCSK9 and NGPTL3 protein, and we are going to have, we hope that there are other novel treatments developed, which are gene modifiers, so we can modify our genes in order to have an LDL receptor that can actually work. So, but these are under phase 1 or phase 2 randomized clinical trials, and we're hoping to get them secured in the future for persons with familial hypercholesterolaemia.
Amazing, thank you.
Thank you. So I was going to go into case studies, but one, we're going to run out of time if I do that. But also, we've covered quite a bit. So, listening to all the conversations, we still have a big focus on making sure that we are diagnosing individuals early. The precision medicine, the fact that, depending on your genetics will impact on how well treatments work, the fact that we want to have a holistic view when we are treating individuals with homozygous FH, the impact that lifestyle still has, even if it doesn't affect the LDL levels as such, but as a person living healthier, moving more, overall, it gives you a healthier kind of outlook on things as well. And of course, the future of possible genetic changes. These are all things that I think we can now look forward to. 5 years ago or 8 years ago, these things were just kind of talked about, where now we can start seeing things move. With that in mind, it is very different depending on which country you're in, and FH Hero Foundation and us as the voice for the people that live with the condition. It's important to make sure that we let people know. So when something comes up or when there's something new, that we can make informed decisions about it. The gene therapy is a massive leap forward, but we need to understand it completely, and so we'll continue to kind of build on that education. I am going to kind of finish in a minute because this is only supposed to be a short kind of overview, and I'm going to ask all of you 2 questions. One, are you going to do the FCS challenge? Sherelle, I know you've already kind of blown that. You might have to do it a different day. The rest of you, are you going to try the FCS 10-gram challenge?
I hadn't planned on doing it, but I don't know now.
You might have to give it a go.
I might have to.
It's been an interesting conversation because, again, also the other connection is with the rare disease community. We have 2 groups, FCS and HoFH, who, although we don't have the same condition, come across the same barriers when it comes to being able to do healthy living, access to treatment, different changes in our treatments and things. So it's always interesting to see where the two overlap. And my last thing is, if you have one message for anybody who is kind of obviously on the journey, but wants to know more, is there anything specific that you can kind of go, actually, this will help you on your journey? I'll start again with Sherelle.
When I first was diagnosed and living with this condition, nothing was said to me that really resonated with me, because you don't know what I'm going through. But maybe coming from a patient that went through the journey herself, I would say, just breathe, because sometimes it get difficult emotionally, and you would need, to rely on yourself, on what you're feeling. You need to speak up. You need to say what you're feeling, and whether it was a doctor, don't be intimidated. Whether it was another person, so just speak up, and everything will be okay. That would be my message.
Excellent. Michelle?
Again, I think Sherelle said a lot of it, a lot of good things. I guess my philosophy has just kind of been, maybe today's a bad day, tomorrow's a new day, and try and start anew every day, and just leave whatever happened that's bad in the past, and try and just kind of pick up and go on. Yeah.
Porteous?
I would say that don't get disappointed. We used to believe that this condition could not be treated, but now it can be treated effectively. So if you find the right doctor, if you are diagnosed early, but even if it is too late for you, but again, never is late for you. So if you adhere to this treatment and to the following treatments that are going to be available in the following years, I'm sure that this condition can be totally cured. So don't worry about it. Don't get disappointed. Stay on the track, and you're totally going to be fine.
Those are incredible messages. So thank you very much. And as I said, thank you very much for kind of stepping in and getting this done. We'll make sure that we share the link for Avery's fight, as well as the FH Europe YouTube and webinar that we've already done with the HoFH Awareness Day, and any of the other papers and Permit FH and Perfecto. We'll share those links at the end of the recording as well. All right. Fabulous.
Amazing.